Dementia is an umbrella term for a group of brain diseases characterized by deterioration of cognition, behavior, and functional abilities. As today there is no curative treatment. We also have some pharmacological treatment, but with modest efficacy at the symptomatic level. And so the first line is the so-called non-pharmacological treatment, which include social intervention group and individual stimulating and training activities. The symptoms of dementia are composed by cognitive symptoms, and the first is memory, which is the most well-known, but there is also language and attention and executive function. And there is also the behavioral symptoms, and the behavioral symptoms are the most disturbing for the family, but also for the patients. And within the behavioral symptom, the most frequent is apathy, which is defined as a quantitative reduction of goal-directed activity, either in behavioral cognitive dimension, emotional dimension, but also in social interaction in comparison to the previous level of functioning. The present program, which is called Cognitive Adaptation Behavior, and which has been developed by the Coptech lab at the Université Côte d'Azur in collaboration with the Association Innovation Alzheimer, was conducted, and thanks to her, with Julie Brousse and Laure Chantepie. The program was to assess the impact of board games on the patient-caregiver relationship, but also to assess the relevance of the adaptation of board games for Alzheimer's disease and related disorder. And so the program is conducted in 3 phases. So the phase 1 is a kind of feasibility test at the memory center with 10 patients, in order to see if it is possible to use the games. The phase 2 is to obtain the opinion of the professionals which are working at home, in nursing home, in daycare center, in order to validate the relevance of the use. Is it possible to use it in their professional activities?
Début de la construction du phare d'Alexandrie. Début de la construction du phare.
The third phase is a small quantitative study with patient and caregiver consulting at the memory center. So we have 10 female, 10 male. The mean age is 84 years old, and the severity of the cognitive deficit is moderate. At the level of the behavioral cognition dimension, it seems that board game is a stimulating tool, because even if the patient has diminished interest, this is not the case for the caregiver, and so it can stimulate him. It is also important to mention that personal interest in a game will encourage its use by the caregiver, who is the main initiator of the game. And finally, it is important to be able to use games that can be closer as possible of the patient interest. Concerning the emotional dimension is best preserved in this patient, and frequently best preserved, and so games are an instrument of emotional stimulation, and this is something which is positive. And finally, for the social interaction, obviously board game is a tool that promotes interaction, but for this it is necessary that there is a partner. Coming to the key points of the overall study, including the phase 1 and the phase 2 results, we can say that board games may be a good quality of life tool if they fit the player's interest. It is essential to offer different games which are adaptable in terms of level of rules and which are ergonomically usable, and that was one of the objectives of the phase 1, is to try to modify a little bit the game in order to adapt it to the patient. Obviously, the board game is not the dementia treatment, but it is possible to consider it as a kind of behavioral and cognitive stimulation, and most particularly if it is practiced on a regular basis. The play partner should not be systematically the caregiver, and the caregiver must be trained, familial or professional, beforehand, so that the game is a pleasure and not the highlighting of the patient loss.